Understanding rheumatoid arthritis, causes, symptoms, and treatment options. Rheumatoid arthritis is a chronic autoimmune disease that affects millions of people worldwide. Rheumatoid arthritis is a chronic autoimmune disease that affects millions of people worldwide. Rheumatoid arthritis is a chronic autoimmune disease that affects millions of people worldwide. It is a condition that causes inflammation, pain, and stiffness in the joints. Rheumatoid arthritis is the most common form of arthritis and is more common in women than men. It is a disease that can affect people of all ages, although it is most often diagnosed in people over the age of 40. Introduction to rheumatoid arthritis, RA, what is it? Rheumatoid arthritis, RA, is a chronic inflammatory disorder that primarily affects the joints. It is an autoimmune disease, which means that the body's immune system mistakenly attacks its own healthy tissues. Unlike other forms of arthritis that result from wear and tear on the joints, RA is characterized by inflammation that can cause damage to the joints, cartilage, and surrounding tissues. The exact cause of rheumatoid arthritis is still unknown, but researchers believe that a combination of genetic and environmental factors plays a role in its development. It is more common in women than men and usually occurs between the ages of 30 and 60, although it can affect individuals of any age. One of the hallmark symptoms of RA is joint pain, stiffness, and swelling, particularly in the smaller joints such as the hands, wrists, and feet. The pain is often worse in the morning or after periods of inactivity. Treatment options for RA aim to reduce inflammation, relieve pain, and preserve joint function. Nonsteroidal anti-inflammatory drugs, NSAIDs, and corticosteroids are commonly used to alleviate pain and inflammation. Disease-modifying anti-rheumatic drugs, MARDs, are prescribed to slow down the progression of the disease and prevent joint damage. In more severe cases, biologic response modifiers may be recommended. In addition to medication, physical therapy and regular exercise can help improve joint flexibility, strengthen muscles, and reduce stiffness. Lifestyle modifications, such as maintaining a healthy weight, adopting a nutritious diet, and managing stress, can also play a significant role in managing RA symptoms. Common causes and risk factors of rheumatoid arthritis. Rheumatoid arthritis is a complex autoimmune disease that affects millions of people worldwide. While the exact cause of this condition is still unknown, there are several common causes and risk factors that have been identified. One of the primary factors believed to contribute to the development of rheumatoid arthritis is genetics. Another significant factor is the individual's immune system. In rheumatoid arthritis, the immune system mistakenly attacks the body's own tissues, primarily targeting the joints. Environmental factors can also contribute to the development of rheumatoid arthritis. Women are more likely to be affected by the disease than men, with the peak age of onset occurring between 30 and 60 years old. Additionally, smoking has been identified as a significant risk factor, as it not only increases the likelihood of developing the disease but also worsens its severity. Recognizing the early symptoms of rheumatoid arthritis is crucial in order to receive timely medical intervention and improve the quality of life for those affected. While the exact cause of this chronic inflammatory disease is still unknown, research suggests that a combination of genetic and environmental factors may contribute to its development. One of the earliest signs of rheumatoid arthritis is joint stiffness, particularly in the morning or after periods of inactivity. This stiffness may last for more than an hour and can significantly impact daily activities. Additionally, individuals may experience joint pain, swelling, and tenderness, often affecting the small joints in the hands and feet. Fatigue and a general feeling of malaise are also common early symptoms of rheumatoid arthritis. Many individuals may feel excessively tired, even after getting sufficient rest. Furthermore, rheumatoid arthritis can cause a loss of appetite, weight loss, and a low-grade fever. If you suspect you may have RA or are experiencing symptoms such as joint pain, stiffness, and swelling, it is crucial to consult with a healthcare professional for an accurate diagnosis. One of the first steps in the diagnostic process is a detailed medical history and physical examination. They will also assess your joints for swelling, tenderness, and range of motion. These tests can help detect specific antibodies and markers that are associated with RA, such as rheumatoid factor, RF, and anticyclic citrullinated peptide, anti-CCP, antibodies. In some cases, imaging tests such as X-rays, ultrasounds, or magnetic resonance imaging, MRI, may be recommended. Instead, a combination of clinical assessments, blood tests, and imaging studies is used to establish a diagnosis. Early intervention is crucial in managing RA and preventing further joint damage. Understanding the impact of rheumatoid arthritis on the body. Rheumatoid arthritis is a chronic autoimmune disease that primarily affects the joints, but its impact goes far beyond just joint pain. One of the main ways rheumatoid arthritis impacts the body is by causing inflammation. Inflammation occurs when the immune system mistakenly attacks the body's own tissues, leading to pain, swelling, and stiffness in the joints. This inflammation can also affect other organs and systems in the body, such as the heart, lungs, and blood vessels. Over time, the chronic inflammation caused by rheumatoid arthritis can lead to joint damage and deformities. This can result in reduced mobility and difficulties in performing everyday tasks. The joints most commonly affected by rheumatoid arthritis include the hands, wrists, knees, and feet. Fatigue, low-grade fever, and loss of appetite are common systemic symptoms experienced by individuals with this condition. Treatment options for rheumatoid arthritis aim to reduce inflammation, relieve pain, and prevent joint damage. This may involve a combination of medications, physical therapy, lifestyle modifications, and in some cases, surgery. Treatment options for rheumatoid arthritis, medications and therapies. The primary goal of treatment is to reduce inflammation, relieve pain, prevent joint damage, and maintain joint function. Medications play a crucial role in managing RA symptoms. Nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen and naproxen sodium are commonly used to reduce pain and inflammation. MARDs work by suppressing the immune system to reduce joint inflammation and slow down the progression of the disease. These include methotrexate, sulfasalazine, and leflunomide.